Okay. All right. Knock, knock, knock. Hello. I'm your nurse, Julie, and I'm going to do a musculoskeletal exam today. First, I'm going to wash my hands. Can you identify yourself, your full name and your birth date?
Fred Jones.
And your birth date?
June 4th, 1972.
Okay. I can verify that in the patient record. Um, let's see. I'm going to draw a curtain so if someone walks through the door, we have privacy. Um, like I said, we're going to do a musculoskeletal exam, so I'm going to look at all your joints and muscles, range of motion, muscle strength to see if you have any problems or issues. Do you have any joint pain or muscle pain?
No.
No joint or muscle pain today? Have you had any injuries recently?
Dislocated shoulder.
When was that?
In March.
In March. So how's it doing?
It's doing well.
Okay, good. No pain?
No pain, but I have a limited range of motion.
Okay, so we'll look at that today. All right, we're going to start with the temporal mandibular joint. And what I need to do is feel here. And I want you to open your mouth and close your mouth. Did you feel any grinding or popping or clicking?
Nope.
Nope. Okay, so open your mouth again. And then close it a tiny bit and move it side to side. And then out and in. And then open up again. I want to see how wide you can open. Very good. Okay. Can you try to open your mouth against there? Oh, strong, strong. Okay, so that was good. And so next we're going to move along to your neck. I'm going to check to see that it's straight, and I'm going to look for any redness or swelling or warmth. Do you have any issues with your neck?
No.
Okay. So I'm going to palpate the vertebrae. Do you feel any pain or tenderness?
No.
Okay, good. Now I'm going to come around to the front and feel the muscles. That feels good. Okay, so now we're going to work on some range of motion. Can you put your chin down to your chest? And then look up at the ceiling. And then put your head in a normal position. And then look side to side. And then to the other side. And then try to touch your head to your shoulder without moving your shoulder, but you don't have to touch it. You just move it in that direction. And then to the other side. Do you feel any pain or issues when you do that? Okay. Let me see. Is that it for the neck? Yep, that's it for the neck. So now moving on to your shoulders. Can you take your shirt off, please? Because I need to see. All right. I'm going to inspect, looking for any visual issues. Looks like maybe your muscles might be a little atrophied from the injury. There's a little bit of lack of symmetry here in the muscles. This is strained right here. Can you tell me about this shoulder?
It's a separated shoulder.
A separated shoulder. Okay. You see a little bump and it goes down here. Is there any pain in that?
No.
Okay. Okay, so from the back I see the shoulders are even except for what I noted there. There's no redness or swelling or warmth. There's no sign of inflammation. This shoulder's a little lower than the other shoulder. I don't know if that has to do with maybe you need to work out. I don't know. But anyway, I'm just seeing that it's lower. Coming around to the front, I can see that little nodule area. And I'm going to palpate down and feel. Do you feel any tenderness or pain?
No.
Okay. So now we're going to do range of motion. Well, first I want to actually test the strength. Can you push up? How's that? You haven't feel any pain? Or?
No.
Okay, so he's still pretty strong there. Now, could you stand up? Let's see if this is in the... Now, can you go like this? How high can you get? Okay, so there's that range of motion issue, but this one's good. Can you go like this? Okay, so there's less range of motion in the side. The sides seems to be okay. Can you put your hands behind your head like this, like kind of a nap position? It's not. You can see that it's not symmetrical on this side. It kind of goes down. And then can you put your hands behind your back like this? Any pain or anything?
Yes, a little bit of
Where you
discomfort
in that shoulder. Okay, so stop doing it. So yeah, can you push out, like push your arm up? Okay, and then push your arm out. Okay, so that's pretty strong. And then push your arm in. Okay, and then push your arm in. Okay, good. So other than the range of motion issues on this side, and looks like the shoulders pretty good. So now from the shoulders, you can sit again. We're gonna go on to the elbows. Inspecting. I don't see any redness or nodules or bumps or anything. It seems normal. I'm gonna go inspect the other side. And the same, no redness, visible swelling. Now I'm gonna palpate and checking the back, and I'm not feeling any problems there. I'll go over this side, do the same thing, get the palpation, and any pain in either elbow?
No.
Okay. So now what I want you to do is go. Okay. Yep, that's enough. And now I want you to try to pull against me, like show me your strength. Okay, that's good. And show me the strength. That's good. So the elbows look good. I'm going to move down to the wrists. Checking your wrists. Now I know you're on the computer a lot. Do you have any problems with your wrists at all?
No.
Okay. I'm not seeing any redness. I'm not feeling any warmth. And I'm going to look on the other side. No redness, swelling. Not feeling any warmth. I'm going to start to palpate the bones of the wrist. Tell me if you feel any pain. Nope.
Nope.
Okay. Do the other side. Feel any pain?
No.
Okay. All right. Can you go? And then. All right. And can you go side? Side. Feel any pain?
No.
Nope. Okay. Now I'm going to test the strength. Can you push up with your hand? There we go. And push up with your hand. There you go. That's good. So the wrists are good. Now I'm going to just demonstrate two tests that you would use for carpal tunnel. If you have carpal tunnel, I need you to go like this. This is the Phelan test. Do you feel any pain or tingling?
Nope.
Okay. That's a good sign. Another thing you could do to test for carpal tunnel is percuss the medial nerve right there. So I'm going to do that. Just relax your arm. Do you feel any tingling or pain?
No.
Okay. I'm going to try it over here. And just relax. Any tingling or pain?
No.
Okay. That's good. So now the wrists are good. And now I'm gonna go on to the hands. Do you have any issues, pain or tenderness in your hands? Okay, I'm looking at the hands. There's no redness, no visible swelling. The hands look normal on the sides. And then I'm going to check the other hand. They look normal, no problems, no callus. Okay, so now I'm going to palpate the bones of the hand one by one. Tell me if you feel any pain or tenderness. Nope?
No.
Okay. And the thumb. I'm going to go on to the knuckles and the fingers. I'm palpating the joints on the side. And I'm not feeling any problems. I'm going to go to the other side. And palpate the bones, knuckles. Here we go. Feeling all of the bones and the joints and the fingers. And and no pain, right? No pain. All right. Okay. Now, can you hold your hand like this and go here, and then up, and then let me see if there's any others I'm going to do. Oh, hold your hand up like this and touch your thumb to the base of your pinky, and then touch each tip of your finger. There we go. And we're going to repeat the same range of motion. Go down, and then up, and then up, and then do the touch the base, and then the tips. Okay. All right. And then just pull. Testing these hand strength. Pull. Okay. So those hands look good. Now, hands, hips. So let's move on to the hips. I'm going to have you come lay down over here. Just sort of there. Yeah, just lay down. I'm sorry. Is it?
My face or back?
Supine. So face up. And then scoot back a little bit. Oh, put your head there. Yeah, I think that's good enough. So now I'm going to feel the hips. Any pain or tenderness?
No.
They're even. I'm feeling no abnormal. There's no warmth or swelling. And that's good. Now we're going to go through some range of motion of your hips. So can you lift your leg, just this one, and then down, and then lift it with your knee bent towards. There we go. And then go that way with your knee, and then this way with your knee. Okay, and then down. Let's see what other is that. And then do that leg. But you want your foot kind of go like, bring the knee in, but move the foot. Yeah, there you go. And then push it out there, and then down, and then lift your leg straight. That one, straight. Okay, and then down. Let me think if there's any other ones I want to do. Abducting. So bring the leg out just to the side, and then in. And the leg out, and then in. Okay, so that's good. That's good range of motion there. Can you lift up against hard? There you go. And then lift up. There you go. And then push, pull, like, yeah, there you go, but push against. And then I'm going to see your strength here. Push out, and then push in, and then go out, and then I want you to push in on the side. There you go. That's good. Okay, you can get up.
Is that everything?
Nope, we're not done yet.
Oh.
Yeah, this is a long one. So now that I'm going to get you standing up, I'm going to have you turn this way. And I'm going to check to see that everything's aligned, the shoulders, this area, the scapula, the hips, and then his gluteal folds are even. That's what I want to see, with the hips the same. Okay, so we did the hips. So now we're going to do the knees. I want you to sit back down. Oops. There you go. Now, I'm going to palpate, I'm going to inspect the knees. Do you have any issues with the knees? Any problems?
I have low patella tendonitis in this knee.
Okay. And does it bother you all the time, or only
after I've exercised a lot.
after you've exercised a lot? What do you do then? What helps with that?
I rest it.
Rest it. Okay. And that helps, huh? Yeah. Okay. So, but this knee doesn't have it?
No.
Huh. Okay. So I'm palpating, starting up here in the thigh area and moving down. Palpating the front and the sides. Not feeling any fluid or any swelling or anything abnormal. Feeling the back. No swelling. No, nothing abnormal. Coming along to this side, doing the same thing. Palpating down the top, front, sides. Not feeling anything abnormal. No warmth. There's no swelling. No pain. No pain. Okay, that's good. So that feels good. So now we're going to do some range of motion. Knees are like a hinge, so they only do some very simple movements. So what I want you to do is do that. Okay, into down, and then the same on the other side. Okay, that's good. And then can you stand up, please? And like turn sideways. And then try to lift your heel up towards your butt. And then down. And the same on the other side. Okay, good. And then you can sit down again. Okay. I want you to lift up against the floor, so like push. And then push back. Okay. And then push up. And then back. Okay. That's good. So his knees are good. Now we're going to move down to the ankles. Do you have any problems with your ankles?
No.
No problems, okay? Alright, so I'm going to look at the ankles. Not seeing anything abnormal. I'm not feeling any swelling. Not seeing any redness or bumps or any kind of strange finding. Feeling the Achilles tendon. The sides. There we go. No pain?
No.
Okay. And then I'm going to go look at and palpate the other side. Okay. And I'm not seeing any redness, no swelling, no strange nodules or bumps. Feel. Not feeling anything abnormal in here. Tendon. All right. Now, can you point your toes for me? Okay. And then flex your foot like this. Okay. It's a little bit limited, but it's happening. That. And can you invert your foot? And then invert your foot. That's also a little limited, but it's happening. Okay. Do the same thing on this side. Point, and then flex, and then invert, and then evert. Okay, so that's a little limited, but it's still happening. Do you have any problems walking or running?
No.
No, okay. All right. Now, we're moving on to the feet. Do you have any problems with your feet?
No.
Okay. Maybe I wonder if, I think maybe you should lie down so it's better, it's on the video better. flat on your back, supine. Okay, your feet are hanging over, but let's pretend like they're on the bed. I'm looking at the feet. Got good arches. You don't have any like plantar fasciitis or any other problems?
No.
Okay. There's no swelling, no redness, no wounds. I'm going to go to the other side. Look for no visible abnormalities, no bumps, no redness, no swelling. Looks good. Now I'm going to palpate the bones of your foot. Have you had any foot injuries?
I broke my metatarsal on my right foot.
So that foot. Okay. Which metatarsal?
This.
That's this. And what were you doing when that happened?
Playing soccer.
Oh. But that was painful. Did it take a long time to heal?
Yes.
Did you have surgery?
Yes.
Ah. Okay, so I felt all the bones. Now I'm going to go to the toes and feel the knuckles. I'm going to move them a little. You can feel me moving your toes up and down, right?
Yes.
Okay. Okay. So I palpated the toes. That's normal. Can you push against my there and then, yeah, there you go. I just wanted to see that. So here we're coming over here. We're gonna. So this is the bone that broke, right?
Yes.
Okay. Is there a? What do you call
A screw.
A screw, right? There's a screw in there, huh? Okay. I can kind of feel it. Does it hurt anymore?
No.
Okay. Okay, so I'm feeling the bones. Tell me if you feel any pain or tenderness. I'm gonna feel the toes, feeling the knuckles here. That looks good. That looks good. All right. Okay, good. All right, you can stand. Okay. Now, now that we've gone head to toe, I'm gonna backtrack back to your spine. Here, I'm gonna turn you towards the camera a little bit. What I'm seeing here, I'm gonna look at this. There's a normal S curvature of the spine, which is good, and straight up and down, and no visible abnormalities, swelling, bumps, any kind of thing like that. So I'm going to just start palpating the vertebrae one by one. Tell me if you feel any pain or tenderness as I'm doing this. I'm not feeling any abnormalities. Everything's as expected. Okay, that's good. So now we're going to do a little bit of range of motion. Can you turn this way? First I want to check the curvature. Can you bend over and touch it? You don't have to touch your toes, but as if you're touching your toes. I'm seeing the C curvature of the spine. You can get up now. That's all. And then what I want you to do is do a side bend, and then another this way. Okay, good. And then do a trunk twist, keeping your hips square. Yeah, you don't have to go so far. Just that's good. And then any pain, tenderness, popping, grinding, nothing like that. Okay. So let's review. We did shoulders, neck, face, elbows, wrists, hands, spine, knees, ankles, feet, and hips. Yes, we did. Okay. you have any questions?
No.
No questions?
Are we done?
Yeah, we're done. You look pretty normal, except for this little thing here, which I don't. And then the range of motion on the shoulder. You might want to maybe see a physical therapist to help you with that. But other than that, I think you're pretty good. All right, thanks.